Seniors are among the most vulnerable to COVID-19. This we know, and the pandemic has exposed massive failings in the long-term care system right across the country. 81% of deaths during the first wave were in care facilities, and many more deaths in those facilities have occurred since. A CBC News investigation into outbreaks in British Columbia is revealing another hidden truth this morning, that the virus has affected certain types of facilities much more than others. Data journalist Tara Carmen reports.
A CBC News investigation has revealed that for-profit seniors' residences in British Columbia have had both more COVID-19 outbreaks and more severe outbreaks than those run by the government or nonprofit organizations. For-profit seniors' homes are where nearly half of BC's COVID-19 outbreaks have happened, but they represent just over a third of long-term care beds in the province. Half of the most deadly outbreaks in BC have also been in for-profit facilities. Isabel McKenzie is BC's seniors advocate. Her office found in a review last year that private facilities provide fewer hours of care per resident and tended to pay their staff less. Still, she says factors other than ownership are also likely at play.
The question is, what is it about the owner, what are the practices that we need to change that are different in for-profit versus not-for-profit. Some of it will be related to the culture.
Frank Rizzardo runs the Florentine Seniors Residence in Merritt, British Columbia. His facility has stayed COVID-free, but he says privately run care homes like his don't have the access to infection control experts and equipment that the public ones do. And this can make it frustrating for him to hear provincial officials talk about all the supplies they have stockpiled.
They proudly announce we have X number of millions of gloves and masks and etc. We aren't part of that supply. That's a government-funded, government facility drawdown. We don't have the luxury of having the kind of dollars that they have.
Rizzardo says he'd like to work with the provincial government to ensure that all facilities that care for seniors in British Columbia are equitably equipped to do so. Tara Carmen, CBC News, Vancouver.